Good afternoon. I wanted to talk to you today about some quick tips on NG tubes. So we've noticed some inconsistencies on management of our Salem sump tubes, and so we're going to provide this video to help give you some education and make sure that you have all the information and resources that you can possibly have to make sure that they're working correctly for you. So the first thing we want to look at here is the supplies that you're going to want to have in the room with you. So obviously we already have our Salem sump tube that will be in the patient. So the way that you know it's a Salem sump tube is because it's going to have this blue port that comes off the end. For those who are not aware, the purpose that this serves, this is actually a pop-off area for air to come out of the stomach. It helps the end of this tube that has the holes in it not to suction up against the gastric lining. When this valve is closed off and the air is not allowed to come out, this can actually suction up against the gastric lining and cause perforations in the stomach of the patient. And so that's why it's so important to make sure that this is vented properly. You're also going to want to have with you a way to anchor your line to keep it in the right location. And so we have some safety pins here. We have some silk tape. And then to troubleshoot our NG tube when it's not draining correctly, you're going to want to have a Lure-Lock syringe. And for the units that allow the use of them, we also have our anti-reflex filter, which is going to come in a package that looks like this. So when your patient has their NG tube in, I'll hold this right there for me. The main thing is for this not to leak all over our patient, which seems to be the main issue that we run into, you have to have it facing upward so that because it works to gravity. You also want to make sure that it's above the level of the stomach. And so the way that we're going to do that, which has actually been recommended by EBSCO, is to secure it to the gown of the patient. And so we're going to do that by creating a little tail on the tube and then safety pinning it to the gown of the patient so that it stays above the level of the stomach and it's facing the correct direction. So that gives it plenty of area to pop off your oxygen and also stay above the level of the stomach. When you have your anti-reflex valve, one of the things we've noticed is they're not always put into the tube correctly. It can be confusing because of the way the label is facing on here. It looks like it would go in the tube like this. That's actually upside down. You're going to put the blue port that has a white connector into the reflex tube like this. A couple of things that I wanted to make sure you're aware of. There's actually a filter, a small paper filter inside this reflex valve. Once that filter becomes wet, it can no longer allow the oxygen to come up correctly. So the main thing is you want to keep this tube to where it's draining correctly. If something comes up through the tube and saturates this filter, you have to take this one off and replace it with a new valve because it's no longer going to work correctly. If you notice that you have some gastric contents coming up through this tube, but they have not yet gotten to this filter, you can take a Lure-Lock syringe, get some air in it, lock it onto your anti-reflex valve, and flush the contents back down into the tube, and then it will suction through correctly into the canister tube, which will be connected to the wall. That is the best way to troubleshoot this. A couple of things that we've seen that we would like to avoid, which we understand the frustration that you're running into, but we want to make sure that this is functioning correctly or else it doesn't really do the patient any good. So a couple of things we've seen where people have taken this reflex or this sump tube, they have tied it in a knot so that it won't drain onto the patient. They have put a clave down in there to stop it up. They have tucked it into a glove or emesis bag to catch drainage. Unfortunately, none of those things are really going to help it to work correctly because any of those things that you put to catch any kind of drainage is going to position it down below the level of the stomach. So it's not going to help with the drainage. All that's going to do is catch the drainage that's coming out of there, but it's not going to make the tube work correctly. Anytime that there is liquid or any kind of runoff in this tube, it's not suctioning correctly from this end of the tube. So we have to keep this emptying and dry. Hopefully that's very helpful. If you have any questions, please post below or reach out to the education department. Thank you.